Throughout my years of working in the emergency department, I've worked with adolescents and adults with substance-related concerns. I'm the bridge that connects them from the emergency department to their community resources. I'm Courtney Vorachak, the Behavioral Health Recovery Navigator at Dartmouth-Hitchcock Emergency Department.
You must have that channel of communication open.
By bringing other people into that process, it broke that feeling of being alone.
More like, oh, we're talking about drugs and alcohol because I'm a teen and I might encounter that.
In the emergency room, I work with any of the patients that come in that have substance use disorders or are experiencing substance-related health concerns. They typically come in and ask for resources or help get connected, looking to go to residential treatment or outpatient treatment. So I'm really the bridge from the emergency room in a crisis to the community to help them get set up with long-term resources. If you or a loved one comes in through the emergency department and has concerns about substance use, you can ask to speak to a recovery navigator or a social worker to get connected. They typically get a medical workup from a provider, and based on the conversation with the provider, then they would contact me to meet with that patient, help them get connected to resources, help them make phone calls to get set up. And once they leave the hospital, if they agree, I can follow up with them in the community and continue offering that support. When an adolescent comes into the emergency department and they're having some substance-related health concerns or just really struggling with substances, I have been able to meet with young individuals with parents' permission a few times. Sometimes they would meet with the social worker, sometimes they would meet with the psychiatrist. It really depends on each person of what the treatment would be based on what the provider thinks is important and what the family and the patient are asking for. When I'm not in the emergency department, depending on what substance the patient is there for and how much engagement they're wanting, the provider can put in a referral for myself to connect with the patient once they're discharged. So that would be by phone call, text message, or an email, however they choose to communicate. If they're there for an opiate use disorder, we provide take-home naloxone kits. A naloxone take-home kit has one Narcan naloxone nasal spray. There is a CPR safety valve breathing mask, and there's also some community resources. There's information on how to get naloxone within your community, about the needle exchange program. There's information on community health clinics, and there's also the 211 information in those kits. So it would depend on what a patient really wants. It's very self-directed. If you have someone in your life that you're concerned about or you think that they're struggling, different ways you can get them connected to resources, depending on their age, could be talking to the school guidance counselor, reaching out to the student assistant provider, calling 211, or any of your local treatment agencies, talking to an outpatient counselor and just trying to get some support that way. In the emergency department, we've tried to combat stigma by offering education, helping providers and physicians become recovery allies and understand that the discrimination and stigma associated with substance use disorders really stops people from reaching out and getting the help that they need. So sometimes people come in through the emergency department specifically requesting detox or assistance with withdrawal. Sometimes they come in with abdominal pain, and then it's then found out that they're misusing opiates or other substances, or they really struggle with alcohol, and that's causing their health concern. It's a little bit different for each person, and based on what they come in and share would determine what care that they get. With youth and adolescents, we are mostly seeing pretty severe mental illness coming through, and a lot of vaping, marijuana use, and a lot of alcohol use in young people. I would say, from my perspective, the most concerning is the vaping and marijuana, and the lack of education around those substances is making it really difficult for young people to make an educated decision on whether they engage in using that substance or not. We've seen young individuals coming in with breathing problems, having shortness of breath, chest tightness, vomiting, increased anxiety, related to their marijuana use. We have seen with an increase of accessibility to these substances, the drug trends typically tend to follow that, where if a substance is more readily available, it is used more in the community. From my experience with working with individuals in the community, really talking about substances and having more of a conversation than just say no, which we know does not work. Talking about why the family chooses not to drink, talking about why there are not family members at the dinner table anymore because of their addiction, because of their mental health. Really removing the shame and guilt that's associated with substance use disorders, I think makes it more real for young adults and adolescents, opposed to mom and dad just telling me no, because that doesn't make sense to me when I see mom or dad using substances, but they tell me drinking's bad or smoking is bad, but they're doing it. Having a conversation around substances, using genuine education, and as a parent, if you don't know, helping your youth find it, helping yourself get educated, talk about it. I think that will make the difference.